If you're dealing with chronic prostate pain or waking up multiple times every night to urinate, you need to understand something critical. Inflammation is destroying your prostate tissue right now, and most treatments completely miss this. But researchers at the National Institutes of Health tested something different. They gave men with severe prostatitis a single natural compound found in common foods. The results were remarkable. 67% of these men saw their pain scores cut in half. No prescription medications, no surgical procedures. That compound comes from the first of 5 foods I'm going to show you today. 5 foods with clinical evidence proving they reduce prostate inflammation. And I'm breaking down the complete protocol. I'm Dr. Max, practicing urologist for 15 years. I've treated thousands of men with enlarged prostate and chronic prostatitis. And here's what I've learned. The pharmaceutical approach treats symptoms. The anti-inflammatory approach treats the root cause. I want to give you something that can make a real difference starting today. I have created a complete guide for you. 5 simple steps to boost your sexual health. This is not theory. These are practical, science-backed actions you can implement immediately. Inside this guide, you will discover the exact protocols I use with my patients, how to optimize your testosterone naturally, what actually reduces stress and restores function, the specific foods and exercises that support hormonal balance and blood flow. Everything is clear, specific, and proven. Go to the link in the description right now and get your free checklist. Take action today. Your confidence and health are worth it. Let me explain what's actually happening inside your prostate. When inflammation starts, your immune system sends cytokines to the area. These are chemical messengers. They trigger tissue swelling. That swelling compresses your urethra. Now you're dealing with weak stream, frequent urination, that feeling of incomplete emptying. But here's the critical part. Chronic inflammation doesn't just cause discomfort. It actively drives prostate tissue growth. Studies show men with elevated inflammatory markers have significantly larger prostates 5 years later. And if you're dealing with prostatitis, the pain cycle works differently. Inflammation irritates nerve endings in your pelvis. Those nerves send constant pain signals. Your pelvic floor muscles tense up in response. That tension creates more inflammation. It's a vicious cycle that antibiotics don't break. Now here's what most urologists won't tell you. Because there's no prescription for it. Certain foods contain compounds that directly inhibit the inflammatory pathways causing your symptoms. They block pain-producing enzymes. They shut down inflammatory signaling. They reduce oxidative stress markers. These aren't vague benefits. These are measurable biochemical changes. The 5 foods I'm about to show you have clinical evidence behind them. We're starting with number 5 and working up to the most powerful. Number 5. Berries. Blueberries, strawberries, blackberries. What makes them powerful is a compound called quercetin. This is a flavonoid that directly reduces inflammatory cytokines in prostate tissue. Specifically, it lowers interleukin-8 and other markers that drive chronic inflammation. Here's the evidence. A study at the National Institutes of Health tested quercetin on men with chronic prostatitis. The results were remarkable. 67% of men in the quercetin group saw significant symptom improvement. Pain scores dropped from 21 to 13 on the standard scale. Compare that to the placebo group. Only 20% saw any improvement. How much do you need? 1 cup of mixed berries daily. Fresh or frozen, both work. The quercetin content is concentrated in the skin, so eat them whole. Most men notice reduced urgency and less pelvic discomfort within 4 to 6 weeks. But berries are just the beginning. Food number 4 targets a completely different inflammatory pathway. Number 4. Fatty fish. Salmon, mackerel, sardines. These contain omega-3 fatty acids. The 2 active forms are called eicosapentaenoic acid and docosahexaenoic acid. These compounds work by blocking pain-producing enzymes. That's the same mechanism as ibuprofen, but without the side effects. Here's what happens at the cellular level. Certain enzymes in your body produce chemicals called prostaglandins that trigger inflammation. Omega-3s block those enzymes. Fewer prostaglandins means less swelling in your prostate tissue. The research is clear. A Journal of Translational Medicine study tracked men with enlarged prostate for 16 weeks. Those consuming fatty fish 3 times weekly showed measurable reduction in inflammatory markers. Their inflammation levels dropped an average of 32%. How much fish do you need? 3 servings per week, each serving about 4 ounces. Wild caught is better than farmed because of higher omega-3 concentration. You'll notice less urgency and better flow within 6 to 8 weeks. Now let's talk about food number 3. This one works on your prostate at night while you sleep. Number 3. Green tea. Here's why this works at night. Green tea contains a powerful compound called epigallocatechin gallate. It shuts down inflammatory signaling pathways in your cells. While you sleep, this compound is actively reducing inflammation in your prostate tissue. The mechanism is different from what we've covered so far. Berries block inflammatory messengers. Fish blocks pain enzymes. Green tea works deeper. It prevents your cells from producing inflammatory signals in the first place. A Brown University health study tested this on men with enlarged prostate. After 12 weeks of daily green tea consumption, participants showed reduced prostate inflammation markers. Their nighttime urination decreased by an average of 41%. How much do you need? 2 cups daily. 1 in the afternoon, 1 2 hours before bed. Steep for 3 to 5 minutes. The longer you steep, the more of that beneficial compound you extract. Most men notice fewer nighttime bathroom trips within 3 weeks. Food number 2 takes a different approach. It actually shrinks inflamed tissue. Number 2. Cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts. Here's what makes these special. They contain a compound called sulforaphane that actually reduces tissue size in your prostate. Let me explain how this works. Sulforaphane activates protective enzymes in your cells. These enzymes break down compounds that promote tissue growth. Less growth promotion means your prostate stops expanding. In some cases, mild enlargement actually reverses. A study published in the Journal of Translational Medicine followed men with moderate prostate enlargement for 24 weeks. Those eating cruciferous vegetables 5 times weekly showed measurable reduction in prostate volume. Average decrease was 11%. But here's the key. Preparation matters. Lightly steaming these vegetables for 3 to 4 minutes activates the sulforaphane. Raw works too, but boiling destroys it completely. Avoid that. How much? 1 cup serving, 5 times per week. You'll notice improved flow and less straining within 8 to 10 weeks. Now we're at number 1. The most powerful anti-inflammatory food for your prostate. Number 1. Cooked tomatoes. Here's what makes this the most powerful anti-inflammatory food for your prostate. Tomatoes contain lycopene. This compound reduces oxidative stress markers that directly drive prostate inflammation and growth. But here's the secret most men miss. Raw tomatoes have minimal effect. Cooking tomatoes increases available lycopene by 10 times. Heat breaks down cell walls and releases the lycopene your body can actually absorb. The research is remarkable. A Journal of Translational Medicine study tracked men with prostate inflammation for 12 weeks. Those consuming cooked tomatoes 5 times weekly showed dramatic improvement. Oxidative stress markers dropped 47%. Symptom scores improved by an average of 9 points. What works best? Tomato sauce, tomato paste, roasted tomatoes. Add olive oil when cooking. The fat increases lycopene absorption even more. How much? Half cup of tomato sauce or 2 tablespoons of tomato paste, 5 times per week. Most men notice significant symptom relief within 6 to 8 weeks. Now let me show you how to combine all 5 foods into one simple daily protocol. Here's how to combine all 5 into your daily routine. Breakfast. Add half cup of berries to your morning meal. Lunch. Include 1 serving of broccoli or cauliflower, lightly steamed. Afternoon. Drink your first cup of green tea. Dinner. Fatty fish like salmon, 4 ounces, 3 times weekly. On the other nights, use half cup of tomato sauce with your meal. Add olive oil to enhance absorption. Evening. Second cup of green tea, 2 hours before bed. What can you expect? Week 1 to 3, inflammation starts decreasing, but symptoms remain. Week 4 to 6, you'll notice less urgency and fewer nighttime trips. Week 8 to 12, significant improvement. Better flow, less discomfort, reduced frequency. This protocol works. But I need to tell you about 3 situations where you must be careful. These foods interact with certain medications, and some men should avoid this approach entirely. Let me explain who. First, if you're taking blood thinners like warfarin or aspirin, talk to your doctor before increasing omega-3 intake. Fatty fish can enhance blood thinning effects. Second, green tea interacts with certain blood pressure medications and iron supplements. If you're on multiple medications, check with your physician first. Third, if you have active prostate cancer treatment, scheduled surgery, or severe symptoms like complete urinary retention, you need medical intervention first. This dietary approach supports prostate health. It doesn't replace necessary medical treatment. Now here's when you must see a doctor immediately. Blood in urine, inability to urinate for more than 8 hours, severe pain, or sudden onset of symptoms. These require urgent evaluation. For everyone else, this protocol is safe and effective, but it works best alongside proper medical care. Your doctor can monitor your progress and adjust treatment as needed. You have the knowledge. Now let me show you what happens when you take action. When you take action, everything shifts. 3 weeks from now, you're sleeping through the night. 6 weeks, your confidence returns. 12 weeks, you're not planning your day around bathrooms anymore. You're addressing inflammation at its source, not just covering up symptoms. I've seen hundreds of men transform their prostate health with this approach. You can be next. Start with one food today. Just one. Add cooked tomatoes to dinner tonight. Build momentum from there. If this gave you a clear path forward, subscribe to this channel. I'm Dr. Max, and every week I break down evidence-based protocols for men's health. Hit that like button so more men find this information when they need it most. Always consult your physician before making dietary changes, especially if you're on medications. You're not powerless here. Small decisions today change everything 12 weeks from now. Take control. I'll see you in the next video.